A breast cancer patient who undergoes chemotherapy can lose her fertility. Now, though, improved egg freezing methods are helping these women.
Get 4 or 5 such eggs.
Trina Mills is just 28 and has aplastic anemia. It didn't occur to her that chemotherapy could rob her of the chance to have a baby.
If it wasn't for my mom bringing this up to my oncologist, I wouldn't have thought about it. You just don't think about the fact that the chemo is going to make you infertile, or has the opportunity, that would do that and make you infertile.
Fortunately, Trina had time to consider her options.
I think when people are diagnosed right away and they are told, you're going to have chemo or radiation, you're scared. It comes out of nowhere, and all you're thinking about is that procedure and the chemo. You're not thinking future or down the road or what it's going to do. I wanted to ask you.
Trina, who lives in San Diego, will spend just 1 week in Las Vegas. She'll undergo tests, and on Sunday, the eggs will be harvested. Dr. Geoffrey Sher is using CGH, or comparative genomic hybridization, a new way of selecting eggs.
For the very first time, we can select the normal ones through a process that looks at all of the chromosomes in the egg without harming the egg. And we test the egg. We know that that's the egg that could make a baby. We now can preserve it through a new method of freezing called vitrification, which is safe for the egg.
Sher says vitrification speeds up the freezing process 600 times. This prevents the egg cell from being damaged by ice crystals.
The vitrification process alone would be of little help if you weren't sure that you were freezing the right egg. So the sorting process is the really critical step, finding out which egg is worthy of storing for future use. Otherwise, all you're offering people is false hope, false promises.
This gives women like Trina facing chemotherapy a better chance at one day having a baby. Trina says knowing she has options is the greatest gift. Dr. Sher is having a free seminar on this process next Thursday. We have a link to his website at ours, LasVegasNow.com.
Tonight, we have news of a medical breakthrough that could help thousands of women desperate to start families. It's an innovative process of DNA testing and in vitro fertilization. Arlinda Hurtado takes a closer look at the treatment and how it's brought 2 bundles of joy to one woman in Tampa.
Hello! Ryan Clyde peeks out from his crib. His twin sister Madeline is in the crib close by.
Hi, cutie.
2 medical miracles, if you ask Mom. In an effort to get pregnant, Jill tried in vitro fertilization 4 times.
It's very emotional. It's about a 6-week time span from the beginning where you start your injectable medicines, you start all your different hormones, your pills.
But they had no success.
It's really tough, yeah. After all you go through, it's tough.
Still, Jill and her husband refused to give up. Like anyone, they looked to the web for answers. And they came upon infertility expert Dr. Geoffrey Sher. The Clydes heard that Dr. Sher was studying and using a new process along with in vitro.
We developed a genetic test that enables us to identify the exact competency of an embryo.
The test, called CGH, checks the fertilized egg to make sure it has all 23 pairs of chromosomes. Most birth defects, like Down syndrome, are caused by abnormal embryos.
This test can tell you very accurately whether that embryo will make a baby, and if we put one such embryo into a woman's uterus, it'll make a baby more than 70% of the time.
Genetic screenings like this have been used in the past for cancer research. Dr. Sher says no one has ever used it to determine if an embryo is normal and healthy before it's placed in a woman's womb. Dr. Sher says the new process doubles IVF success rates, reduces the chance of miscarriages, and virtually eliminates the chances of multiple births.
Because you only have to put in one at a time instead of putting a whole lot of embryos in, which is much like throwing a lot of spaghetti against the wall in the hope that a strand sticks. And often too many stick, or nothing sticks, as is more often the case.
In Jill's case, 3 embryos came back genetically normal. She and her husband chose to implant 2.
After Christmas, we went in for the ultrasound and found out there were 2.
Dr. Sher wants women to know this is not a test to produce good embryos. It's a test to identify them. So not every woman will be a good candidate.
Could Viagra be used to treat something other than impotence? 3 years ago, we reported on a doctor who prescribed the drug to 4 women who hoped to become pregnant. Most of them did. So then, has this use of Viagra caught on? Elizabeth Cohen examines that question this morning.
Catch. Put your hands up.
Alex owes her life to Viagra, her parents say. No, her father didn't take it. Her mother did, after conventional fertility treatments failed.
They didn't have any answers on how to help me. There was nothing that they could do for the problem that I was having.
The problem? Not enough blood was flowing to Melissa's uterus to support a pregnancy. So this doctor got the idea, if Viagra gets blood flowing to a man's genitals, why not to a woman's uterus? The doctor gave Melissa vaginal Viagra suppositories. Several days later,
he called and he said, "Melissa, are you ready to be a mother?"
And now they await their second Viagra baby. Dr. Geoffrey Sher says he has another 400 women like Melissa, women who failed in vitro fertilization, often several times, and then they got pregnant on Viagra with no harm to mother or baby.
There's no doubt that it works. There's also no doubt that it doesn't work in everyone.
Melissa says she's living proof that Viagra works.
For me, it worked great. I mean, I can prove that with the 2 children that I have.
And Dr. Sher says he was not surprised the pregnancies resulted after the women use Viagra, but he stresses only a small percentage of women with infertility have this problem, which could be helped with the drug Viagra.
The medical world has been debating the ethics of fertility doctors who implanted 8 embryos in a woman who already had 6 children. Some doctors say they cannot dictate to patients, but others say it was the worst breach of medical ethics. Dr. Geoffrey Sher told me today that regulations are needed to curb such practices. He says fertility specialists are trying to help women.
And then to have somebody come around and put in 8 embryos into a younger woman and leave her with a single mom who doesn't have the resources, already 6 kids at home. To me, it's unconscionable, to be perfectly honest, and an embarrassment.
Dr. Sher says, though it's tricky to set guidelines because the number of implanted embryos often depends upon the age of the would-be mother.